The Endosound EVS system is a revolutionary new technology which allows you to perform high-quality EUS exams in your ASC, utilizing your existing scopes with a significantly smaller capital investment when compared to currently available EUS setups. In this video, we will show you both the ease of use of our system, as well as examples of the high-quality images that can easily be obtained. The transducer is placed alongside the scope and visualized at the 11 or 12 o'clock position. To intubate the esophagus, simply angle the transducer along the patient's tongue and proceed under the epiglottis into the piriform sinus as you would with a standard endoscopy exam. Once the scope has been passed through the esophagus into the stomach, you are now ready to begin your EUS examination. The ultrasound machine connects to the SDI input of your existing processor and can employ a picture-in-picture image for easy swapping. Once your exam from the stomach is complete, you are now ready to advance your scope distally towards the duodenum in order to complete the remainder of your examination. Intubation of the pylorus is easily accomplished with a simple maneuver. Visualize the tip of your transducer and approach the pylorus with the transducer facing forward. By allowing the transducer to tip into the pylorus first, you can now lift up the pylorus and easily advance the scope into the duodenal bulb. Once in the duodenal bulb, advance your scope to the apex of the bulb and continue your EUS exam. From this view, you should readily see the head of the pancreas and the common bile duct coming into view. In this patient, we see an excellent example of the quality of the image obtained with the EVS system. The pancreatic duct and common bile duct are both located in the same view, and ductal anatomy is confirmed utilizing the Doppler window. However, you will notice that the pancreatic duct is moving perpendicular to the bile duct, suggesting a pancreas divisum anatomy variant. In fact, you can follow the pancreatic duct to its insertion in the minor papilla. Now that the exam from the duodenal bulb is complete, we can switch screens to advance to the second portion of the duodenum to complete our EUS exam. This is easily done with forward viewing capability, and the EVS transducer can be used to aid in mobilizing the duodenal folds within the duodenal sweep. An advantage of the EVS transducer position is that evaluation of the uncinate process and ampulla is easily accomplished from the second portion of the duodenum with minimal manipulation. As you can see in this video, the EVS system by Endosound is a revolutionary new way to perform high-quality EUS exams in your ASC, improving access to EUS for your patients and driving profitability for your ASC.